afternoon, everyone. My name is Rochelle Seeger. I work here at the Foundation for a Healthy Kentucky, and I'm so glad you've joined us on today's webinar. I know it's Friday afternoon, so we're thankful that you're here today, and we have a great presentation for you. The Foundation for a Healthy Kentucky was founded in 2001, and its mission is to address the unmet health needs of Kentuckians. The Foundation does that by developing influencing policy, improving access to care, reducing health risk and disparities, and promoting health equity. The Foundation for a Healthy Kentucky's website is healthy-ky.org. On that website, you can find a number of reports, the current areas, focus areas that the Foundation is working on, some history of the Foundation, our upcoming events, news releases, and also you can sign up for the Foundation newsletter. Also on the Foundation's website is the Kentucky Health Issues Poll survey. That survey is of Kentucky adults, and I work on that effort for the Foundation. And the Kentucky Health Issues Poll is sponsored in part by the Foundation and also a health foundation serving the greater Cincinnati area, including northern Kentucky, called Interact for Health. You can find those issues briefs on the Foundation's website under the Research tab. Also on the Foundation's website, you can learn more about the Foundation's governance. You can see who's on the board of directors, and also you can learn about who's on the Community Advisory Council. The Community Advisory Council was built out on the founding of this organization so that the Foundation could be informed by the work and efforts of Kentuckians across the state. On the Foundation's website, you can learn more about the council, and nominations are open and accepted on an ongoing basis for the Community Advisory Council for the Foundation. There are some areas that the Foundation is looking for to fill. So for example, on this slide, I list the AD districts, the area development districts, that we're looking for new members from Buffalo Trace, Five Coke, Gateway, and Cumberland Valley. And there's also some other characteristics listed on the website that you see there, because the Foundation bylaws calls for this council to maintain a diverse membership with broad community and consumer representation, and ensuring careful consideration to ethnic, gender, geographic, and racial balance. We welcome your self-nomination, or you can nominate someone in your Kentucky community. So check out that opportunity available on the Foundation's website. Another effort of the Foundation for a Healthy Kentucky is the Coalition for a Smoke-Free Tomorrow. That coalition is working on health policy work in Kentucky so that we can move forward to a smoke-free Kentucky. You can check out all the information there, including joining their email newsletter list at smokefreetomorrow.org. This series, the Health for a Change training series, was founded in 2011, and it's to support the work of people just like yourselves, health advocates across the state of Kentucky, health departments, and other advocacy groups and folks who are working to improve the health across Kentucky. We've had in-person workshops and webinars, and this series has reached Kentuckians in all 120 of Kentucky counties. Today's webinar is being recorded, and in a day or so, you'll get the link to the full recording and the slides from today's presentation. So feel free to share that with your friends and colleagues. On July 11th, we'll have another webinar, and that's going to be on the topic of food again, but this time we'll be talking with Michelle Howell, who's in Allen County, Kentucky, about some of her work. Please join us for that free event on July 10th. This Health for a Change training series I'm glad to lead, but it's not me. It's all about the great partnerships across Kentucky and the people who are sharing their stories, their work, their expertise with us. We've partnered with many organizations such as the Kentucky Center for Smoke-Free Policy, Kentucky Nonprofit Network. We did a great series about the 2020 census and the importance of completing your U.S. Census. earlier this month, I spoke with Virginia Bradford, who's over the Kentucky African Americans Against Cancer and also involved with the Kentuckiana Black Nurses Association about her work, a response to COVID-19 and cancer in our communities. We partner with Louisville Free Public Library, Kentucky Injury Prevention Research Center, and also with Jessica Bellamy, who did a fantastic series of in-person workshops on infographics and data equity. Jessica's work can be seen at her new endeavor called the Root Cause Research. Again, this is all about partnerships in our community. And I welcome your ideas. What's happening in your community? What do you want to hear about in this training series? Who do you want to hear from in Kentucky? I always welcome your ideas on topics, presenters. I'd love to hear from you about the Health for a Change training series. A reminder, if you're on the computer side of things, you can also chat in questions to us directly. They come to us, the presenters, via the chat function, and we welcome your questions or ideas there. And again, as I mentioned, all of the previous Health for a Change events are archived with recordings and slide decks on the Health for a Change webpage. Now I'm thrilled to turn the call over to our presenter today, Valerie Horn. Welcome, Valerie. So glad you're with us.
Thank you. Thank you very much, Rochelle. Very, very happy to be here, and always pleased to be a part of anything that's with the Foundation for a Healthy Kentucky. And I appreciate the work that you're doing across Kentucky, and I particularly appreciate this opportunity. Look forward to the program with Michelle Howell next week, and thanks for bringing attention to this work. So, hello all. My name is Valerie Horn. I'm in Whitesburg, Kentucky, and thank you for sharing your Friday afternoon with Rochelle and I. Please know that I'm happy to slow down and give any particular information that anyone would like. If there's a particular area of interest that you'd like me to spend more time talking about. But for now, I'll begin just sort of sharing a bit about myself, about my community, goals for our community, and also to recognize and want to point out that I'm representing several people and organizations, and I'm happy to be here for them. So, a little about me. I am a retired school counselor. I've always lived in Whitesburg, Kentucky. This is a photo by Malcolm Wilson, who's a local photographer here and does Humans of Central Appalachia. This was actually at one of our farmers markets. So local foods are the area that we are giving the most attention to and is serving as a catalyst for change in our community. Organizations that I am most involved with are Cowan Community Action Group. I'm the director of that organization, and you'll hear more about their work. I am the board chair for Whitesburg Farmers Market and Community Agricultural Nutritional Enterprises, Kane, Inc. I also work with Appalachian Groundswell, which allows me the opportunity to work with these organizations as community engagement person. So that's the titles that I have. It's actually one of the hardest questions I sometimes get is, what is your title and who do I work for? And the answer in my gut is always, I work for the community. And I try to put community as those that I'm working most for and with. So a little bit about our community. Whitesburg is the county seat of Letcher County, and you can see a bit about some numbers about Whitesburg there. That's our best view, Pine Mountain. Pine Mountain is the second highest peak in Kentucky, Black Mountain being the highest, and you can look over and see that. So we feel it's a beautiful area that gives a lot back to us in that regard. But there are some persistent problems obstacles in our community that we have to work to overcome. You can see the income and unemployment, poverty rate is lower in our county than across the state, and Kentucky is some of the lowest in the country. So there's almost 1/3 of our population are SNAP recipients. 73% of our children are free and reduced. So there's some significant economic disadvantages in our community that play out in many different ways, including some significant health disparities. If we look at some of those health and wellness facts, you can see here in Letcher County that 37% report less than good health, 37% of our adults. Diabetes, and this number even feels a little bit low, but 23%, I think it's really pushing close to that 30% of adults have diabetes. Heart disease is a large issue also. We have high rates of cancer. So there are a lot of people in our community who are not well, who are not physically well. And part of the work that we're doing began with what are lifestyle changes that we can make or opportunities that we can put in place, access that can improve those disparities. This slide here is with the wellness check. If I'm in Lexington in the Berea area and I did this presentation for an assembly there, and you can see the route as I start to drive home and make my way from Berea or Lexington back to Whitesburg, Kentucky. And as we do that, our life expectancy in those 2 hours can drop 4 to 5 years. So we have to question, why is that? And what are the factors that are in place that are creating a community where we live less healthy and we die earlier than our fellow Kentuckians just a couple hours away. So those are sort of some driving factors about where we are and issues that we want to address. Through them, I work with Cowan Community Action Group, and Cowan Community Center is just a small community center outside Whitesburg city limits at Cowan, Kentucky. We have a lot of programming in place there for a small organization. The Kids on the Creek summer camps, music school, Levitt Amp music series, Grow Appalachia program, our USDA food service program, and an internship program. I have been a part of Cowan Community Center probably since the center began, and I started as a 5-year-old in the daycare there. So it has grown and been a part of my life through the past 50 years. They've recently celebrated their 50th anniversary with that. To tell a little bit about me personally, my parents were very involved in the structure and organization of Cowan Community Center, and it began as a grassroots organization when a local school consolidated, and the community, when they lost their school, needed some area to stay connected, so they worked to have that remain a part of the community. And from that, we've always had a daycare at the Cowan Community Center for 50 years. There's been child care in this community that families can drop their children off with. There's been a garbage service. Cowan was the first in the county to have rural garbage pickup, and local leaders at the community center purchased the garbage truck, provided the garbage service until the county took that over for the rest of the county. The same with TVS Cable. It began as a service through Cowan Community Center and then became a private opportunity. But Cowan has worked to see and identify needs of the community and bring those services to life for all. Save the Children has been an integral part of the Cowan Community Center and helped it live through some really hard and lean years and gave a great support to the center. So I always want to recognize them. Things that we see here that we're happy to do are summer camps at Cowan, and we have 4 weeks of camp programming. The picture you see of the kids with the beans, they're actually stringing their beans while the Lexington Philharmonic is there for a presentation. So they're a part of that. Funding for that comes through Berea Appalachian Fund. Cowan Creek Mountain Music School will be celebrating their 20th year next year. Would normally be happening this week with musicians from across the country gathering to learn traditional mountain music from others, but for safety reasons, that turned into an online opportunity, and we postponed that until 2021. Same with Levitt Amp Whitesburg Music Series. Cowan partners with City of Whitesburg to bring that programming to downtown Whitesburg each summer. This year would have been our 3rd summer that we were set to offer that to our community, and that's a series of public free concerts, 10 concerts that with usually national acts that are available for the community to attend for free. And again, that falls along the line of access. Is what we are working for, and goals that we have are to make accessible to all the things that make for better and healthier lives. We're really proud of Levitt Amp, and the partners we have there are primarily medical care providers. ARH, Appalachian Regional Health Care, is our presenting sponsor. So they help bring the national acts here. It's tied to our farmers market, happens with them, and food, music, healthy shopping is available there 10 weeks out of the summer, and it's also tied to community meals at Kane Kitchen. We'll talk about more, but it's connected to this work also. But on these Thursday nights, it would not be unusual to have 400 or 500 folks who are gathered at Kane Kitchen for a free community meal. Another program Cowan is happy to share is the Grow Appalachia Cowan Community Center program. And this is our 8th year as a Grow Appalachia site. That is through Berea College also. Cowan has a strong partnership with Berea College in several regards. But we have over 100 families enrolled this year. And we do what we can to reduce barriers for families to grow their own food and produce. Last year, our participants harvested over 250,000 pounds of fresh produce. Much of that goes to our City of Whitesburg Farmers Market, but not all by any means. So a lot of it is just to get the families the healthy food. Grow Appalachia offers services like soil preparation, preservation. We offer seeds and plants, organic supplies, and that is a part of the program. Best practices and classes. This year been a challenge again. Lots of pivoting this year. Our classes had begun, but when gathering became not a safe option, we weren't really sure how we would proceed with that. But our effort has just been to get to growers what they need to be successful in their garden. Had a little initiative that was to get as much of Letcher County plowed as we could. So at least 50 gardens we were able to plow for community members to be ready to work in their gardens. Lots of plants from a local plant place were distributed. Fertilizers. We have a project with the University of Kentucky. We got a lot of blackberry bushes out to growers, and continue to work with growers to offset the expenses that might come, and to offer, again, safest and best practices with that. A big part of Grow Appalachia has been our canning and preservation classes, and food preservation. We actually did these at Cowan Community Center in a pretty simple kitchen. Sometimes we use space outside, but we could have as many as 40, 45 people who would be gathered to make pickles. And I just never ceased to be amazed and impressed and sort of awed by our community in that they show up, and they show up with little expectations, and they show up with open minds, open to learn new techniques, new recipes, and likewise open to meet new people and meet neighbors. So these pictures here kind of make me even a little sad and nostalgic, because I know the love and the feeling that was in that room as families would come to attend. I know some of the stories when I glance at these, that I see people who got back from cancer treatments the day before, but wanted to be sure and be there for the class. I see people working together who would think that they don't have anything in common, that they don't share the common beliefs, and that they really couldn't like or accept each other. Examples of that might be a coal operator or family who's been a coal operator, and they're working with someone in the Sierra Club and deciding how much spice to put in their pickles. And they find that common ground and that common denominator that allows us to see that we have more in common than not. So just a little personal bit there. And all this happened here at the Cowan Community Center. The white picture is the old school that was there until it burned in about 1970. And then it's been replaced with a newer version of the Cowan Community Center. Of course, for me personally, this is my backyard. This is my home, and this is the inspiration to do and give back to community. When I see the picture of the white school building, I can overlay it with the stories that my mother has shared with me over the years about being a student at the school there, and meeting my dad there in the fourth grade. When he came to school at that little school, there's a stream and a creek that runs beside it. She was the youngest of 9 children. Their lunches would go in a creek to be kept cool through the day. At lunchtime, they got their bucket of beans out and their spoons, and they would share a bucket of soup beans. My dad had come in, and she said that he was maybe the the best thing she'd seen. That my mom really values cleanliness, and that his overalls were creased and his white shirt was creased, and he was squeaky clean. And then at lunch, the first day she met him, he opened up his brown paper bag for his lunch and unwrapped a sandwich with white bread and lunch meat on it, and then he pulled out a pink um, snowball cake. And she said that she decided right then that that's who she wanted to spend her life with, and that she was going to marry him and be rich. And now to tell the story, the way she ends the story is they were never rich, but she did eat a lot of bologna sandwiches and snowball cakes. So that's what I see there with that, and thank you for allowing me to share that with that story. And then the other building, those stories just move right on into the new building. And community is that's the place that people have their showers, their weddings, their funeral meals. So it's a big part of community, and that's one of the mottos that we say with Grow Appalachia is that it's growing community one garden at a time. Um, these are the leaders in our community, the women that we look to, and there are more, definitely more than them, but these two are still active. Carol Lyson is in the back. Nell Fields is in the forefront. Nell is the chairman of the board now. She was at the school with me as a young teenager and helped with my child care. So this community and this community center is a family and has lots of roots, but we are stretching and we are growing and making room for any who want to be a part of this work and trying to stretch that. Cowan, one way that we're growing is we're part of the Letcher County Culture Hub, and that's an organization that's part of Apple Shop. Apple Shop is the fiscal sponsor, and it has about 15 partner sites that work with us to create power and affect change in our community. Cowan also actively supports the City of Whitesburg Farmers Market. Our Grow Appalachia participants grow into that. And then Cowan is the sponsor for the USDA Summer Food Service Program. Picture you see there is a young lady on a fender blender, so children make their own smoothies each week at the market. Some more of our Grow Appalachia, from our youngest to our oldest, and work that goes into that. The market from Grow Appalachia, and I talk about Cowan, the farmers market, and the Cane Kitchen. If you can think of it as a continuum, that some of this work began with Grow Appalachia and families growing their garden, and then there was excess, and what do we do with that excess, and how do we imagine other work when so many jobs are being lost with mines and mining, and how do we think about other opportunities and begin to think about being an entrepreneur? So the farmers market grew from that excess food with Grow Appalachia and other folks in the community also who were growing. And then we take it a step further. After the market, we're going to grow into the Cane Kitchen that provides opportunity for value-added space. So this is our market. We're nestled in. We're in downtown Whitesburg. The city of Whitesburg is a wonderful fiscal sponsor. They provide a space for us and work with us to make the market a success as it has grown into over the past 6 years. We're still a tent market, tents and tables. And at first I was really excited and thought we had to have that structure. And it is a goal, and it's a goal for next year. But what I would tell anyone is not having that structure won't keep you from being successful, and likewise, having it may not make you successful. My granddaughter said last night, who's 7, that's planning to come to the market with me tomorrow, and she knows it's different under these COVID-19 restrictions, but she was reflecting on that and shared, the market's different this year. I know it's different, but the people are still there, and that's what makes the market. Same granddaughter, maybe when she was 4, got out at the farmers market in Lexington. It's not unique to just our community. This is happening in communities, your communities, and communities across Kentucky and the country. But when she got out in Lexington at the farmers market, she opened her arms, and it's her first visit there, and she said, I know these people. These are my people. So there's a feeling that comes with the farmers market that is happening there. A little bit of the details of our farmers market. Feelings are good, but realities and finances and being able to show impact and success are good, as are very important as well. So we've got the numbers on here. Our first year in 2013, the market was $6,000, and you can see that it has grown. It's to $137,000 in sales, in total sales. Part of that is because of a fantastic program that I'm happy to be a part of, is the pharmacy program. That's a partnership with Mountain Comprehensive Health Corporation, and it's a veggie incentive prescription program. So this year we have opportunity for 150 individuals who have diet-related health issues to come to the market. And this year it's different. This year it's a CSA, but every year in the past they've come to the market and they get tokens. They get to meet farmers, choose and select, and shop at the market. That program has met with success as measured through MCHC Medical Care and others as well. We also, another incentive program we have is the UK Walking Program, and that's a partnership with University of Kentucky and Dr. Dawn Brewer, and participants are incentivized to walk, and particularly to walk to the market. So if they walk to the market, they get $10 to spend at the market. And that's a way to increase physical activity and have more fruit and vegetable consumption. The Community Farm Alliance Double Dollars program brings in additional funds to our market and makes dollars for community go further. We're able to double SNAP, WIC seniors at the market and are excited about that opportunity and the support of CFA, Community Farm Alliance, and the Farmers Market Support Program is tremendous, and I know that they receive support in some part from the Governor's Office of Ag Policy, and this really makes a difference. We're excited this summer to be able to double SNAP benefits to families that have the pandemic EBT card at the market. So we do SNAP, Senior, WIC. We also have, we've had 2 programs that aren't listed here, a backpack program. So families who have children who received a backpack from their school on weekends because they were food insecure, could come to the market, and actually they received a $25 stipend. Was a little more significant. We felt like the need was more significant, and we felt like we had to justify their means to get to the market. And we also had community support from Double Quick in a $10 gas card, so that they were able to justify the expense and that travel to the market. So again, our market, and we also support the Leatherwood Farmers Market with these programs and other work there too. But the key of the market is access. To make these fresh fruits and vegetables available to all in the community, and socialization, to provide a gathering space in our community that all can be comfortable at, that all can be welcome, that whether you have an active debit card or EBT with just a little bit on it, that there is still a place for you at our market. Our vendors are growing, and that's the other piece of it, is all of these programs support agriculture. We are not asking growers to provide this produce to a vulnerable market at any type of discount to themselves. They are receiving premium value for their product, for bringing that in and making it available at the market with that. So there's support for growers to grow. There is a market that we bring, a vulnerable and a necessary market that we bring to the market, and a safety net that what they bring will be served. Not going to have to bring it back home. At the market is a summer feeding program. We at the market were the first in the state and possibly the nation to offer the USDA Summer Food Service Program at a farmer's market. This was an exciting venture that began while I was with Community Farm Alliance, working there as a Healthy Communities Coordinator, and with the University of Kentucky with Apple Tree Project. But we use fresh vegetables and make a smoothie with fresh fruits and yogurt and local honey, make that on site and pass that back out to the community. So we're happy to incorporate and use those fresh veggies there, get them back out to you for free for youth under 18, and low to no cost for adults that want that as well. This year we've had a huge expansion with our summer food service program that I'll share with you now. That summer food service program, in response to the pandemic, has grown greatly. The Tanglewood Walking Trail program, there's folks who walk the trail, come to the market, and then they do get the $10 to spend at the market. So it's an opportunity in most cases, not this summer, but in most cases for community to socialize, exercise, then purchase and have access to the fresh fruits and vegetables to take home and have the next week. Results in that showed significant gains, significant benefits in multiple categories with that. So we have, with Dr. Brewer and our farmers market, we've just recently applied for a National Institute of Health grant that we hope will be able to expand that to other farmers markets in our communities. This is just a clip of the pharmacy program, and the pharmacy program begins in the doctor's, in their medical care provider's office. It's not something that you sign up for at an office. but in your conversation with the doctor, you would be given information about the program, and on a prescription be prescribed the fresh fruits and produce prescribed to the patient, and they would get that filled, bring that to the market, and get fresh fruit and produce to take home. The pharmacy program, the picture that you see now is what our market would look like on opening market days. This one's a couple years old, certainly not this year. We are not having crowds like that at the market this year. In fact, the pharmacy program has moved to a CSA model, and it is a drive-by at the Cane Kitchen that participants drive by. The growers bring in produce on Wednesday. We aggregate and get those bags together, and they drop off on, and then the participants drive by on Thursday and pick up. But this was the photo would be like 9 a.m. starting time, and then they would sort of be in a hurry to get to their favorite vendor. I'll say that those large crowds had decreased, and I don't think that's necessarily because the excitement in the program ended, but because our growers began to have more produce available, and those participants felt more confident and comfortable that if they came even an hour later or 2 hours later, that there would still be product available, and they would be there and able to have that. So did not feel that they had to rush to be there at the first minute. And so this site and picture here is not at all uncommon for the market on when we're functioning under normal conditions, that many of the patients are with walkers, with oxygen, and so our market tries to have things in place to be responsive to and careful with those patients. We have chairs and sitting areas. Help folks get their equipment to the cars, get their produce to the cars. Over the years, and what the pharmacy translates to also is about $5,000 that comes into our market each week. And MCHC sort of monitors and makes that happen with their patients for us. So those are guaranteed sales that come to our farmers each week. And then the patients get the opportunity to have conversation that deals with that. I see a good question here. The Mountain Comprehensive Health Corporation pays for the produce. They have a Finney grant. They've had a Finney grant for the past 3 years that has managed that. The first few years they handled it on their own. So they take the responsibility for the funds. Just what we do, our farmers at the end of the day check out with our market manager, and we have a sheet where they would list, I received tokens for the pharmacy program, I received tokens for the walking program, I received tokens for the kids booth, I received tokens for the backpack program, and tally all those up. Our market writes a check to the farmer, and then the market bills MCHC or the appropriate folks to be reimbursed for those payments. It's a very precise, and it's not really complicated process, but there is a definite process to how that has to work so that all our funds are accounted for everyone gets what they deserve, and that happens. And we're very fortunate to have a market manager who, and I use that word. I'm not really sure it's the best word for her, market coordinator, who gives it's close to a full-time job that she does, at least 20 hours a week, year-round, to keep our market in a position that we can work with these organizations and be able to accept these opportunities when they come along, and to help our growers be able to meet the guidelines for that. So it's a challenge, but it pays off, we believe, for our community, the participants, the farmers, and then our community as a whole in having that there. Market is different without pharmacy patients there. That takes about 100 people away each week. We're not doing our Thursday market this week that was tied to Levitt AMP. That was a bit of a different crowd. There was always more cash spent on the Thursday night market, and there was a real partnership there, and the concert and the farmers market fed off each other. So with no Levitt AMP this year, farmers market opted not to open on Thursday, but we just do the one. I think our crowd count on Thursday was, or Saturday morning. And as I talked before, we moved from home gardens to the farmers market garden to Cane Kitchen, Community Agriculture Nutritional Enterprises. Again, a strong partnership with our medical care community, Mountain Comprehensive Health Corporation. They are the owners of the building that Cane resides in. You can see a picture of our events room, the round room, and a bit of a picture of the kitchen inside. It's 6,000 square feet. This next August 31st, we'll be having our 2-year anniversary. We opened on August 31st 2 years ago, and I'll talk. It is thriving at Cane, although most of this year has been a challenge with COVID. We've had to cancel maybe 60 events with that, and we regret that, but we're finding ways to be useful and involved. So with Cane Kitchen, we have opportunity for growers to create value-added product. You see Southdown Farm here, who are making applesauce and apple butter. We have Friends Drift In Kitchen, who are local growers who make jams and jellies. And I'm really excited about those folks. If you're in Louisville, they are at Omni Hotel, and they have a contract with Bourbon Barrel Foods for, at one point I heard their contract was for 500,000 jars of jams and jellies. I think it's been interrupted somewhat, but just this week we shipped out for them to a distributor at Kentucky Miss Moonshine, which has a new facility in Orange Beach and in Myrtle Beach. So they shipped out jams and jellies to their locations. There are cosmetics made at the Cane Kitchen. So it's a place that a grower would be able to make a product for and and be able to sell it to the world. Cane Kitchen also offers education opportunities. We have American Heart Association having classes there. The UK has some health classes there as well. And for sure, we have our community meals and events there as well, with a series of those, with maybe 750 being the largest community meals event that we served. But they grow, and they're anywhere from 20 to 750. What's happening at Cane Kitchen this summer that is terribly exciting for all of us and is a partnership with Cowan Community Center are the USDA Summer Food Service Program meals. And with the meals, with the pandemic, we're allowed to do meal kits. So if you see the picture here with a gallon of milk and some lunch meat and bananas and some produce, cereal, the USDA asks that we provide 7 breakfasts and 7 lunches. So a family will drive by once a week and pick up groceries for 7 breakfasts and 7 lunches. We're also including local produce in those as we have available. In the front picture are some greens from Southdown Farm, and they're making it from their bag to their skillets to the plate to a child enjoying them. So how that looks so far this year is we have served 242,774 meals since May 11th. We have almost 2,500 families registered and almost 4,000 children who are coming through to get those meal kits each week. We're able to employ, we have about 36 youth employed who work different teams and shifts, and are being able to put income back out into the community with that, as well as food back into the community. Happy to say that the fresh produce that we purchase for summer meals, we partner with Department of Agriculture and Feeding Kentucky with the Veggie Incentive Program, and are able to get a reimbursement on those fresh fruits and vegetables. Example of how this has worked on some days, one of our farmers, a mother of 3, drove through Cane Kitchen, and this is a former high school, so it's a nice setup. But she drove through, she dropped off her fruits and vegetables to Cane Kitchen. A youth unloaded her trunk with that. She gave them the invoice. They brought it into Cane Kitchen, delivered her fruits and vegetables, kept going through the drive-thru, got her groceries loaded, and drove on out. So our aim is to be accommodating. Number one, this year to be safe about everything that we can be, and move on from there. So on one day while we were doing this, one of our farmers this was one day this week, he brought in his produce for the pharmacy program. We had Cowan staff workers there getting the camp kits back together. We were building the CSAs for the pharmacy program in the parking lot, passing out the meal kits. He stood and looked there for a second, and I said, "Hey, Bennett, what's up?" And he said, "Nothing. I'm just looking." He said, "This looks like the war effort." And I know it's not, and I don't want to make light of either of those, but our community is really pulling together to ease burdens for families however and whenever we can. And I know that you're doing it in your communities, and I'd be anxious to hear about that. I appreciate any who have listened or will listen, and I wish you and your community all the success in the world, and I wish that there were easy ways for our communities to connect and exchange and share our ideals and know each other, and our our boundaries opened up so that we all are connected and working together. So I thank you all, and I will pass this back now to Rochelle and see if there's anything she'd like to say before we close out. And I wish you all the very best weekend and summer and life. Thank you.
Valerie, thank you so much for sharing your story with us. This series, part of Health for a Change, I had the idea about more than a year ago. I said, I want to talk to people across Kentucky because I do have the chance to meet them briefly, but they really inspire me every time I go into the community and meet them or visit their events, visit their farmers markets, visit their programs or work that they're doing to improve Kentucky. So I did call it Kentucky Inspired because this is what I do when I look for inspiration, look at the people just like you, Valerie. Thank you for sharing your work with us today. I love the idea of how you respond to people when they ask you who you work for. You say, I work for the community. Thank you for that. Thank you for sharing the history. You reminded me of my parents, the story of my parents' meeting, so thank you for sharing your history, your personal history, the history of Cowan Community Center, and of your work in Whitesburg, Kentucky. It is a great honor to have spoken to you today. And thank you for everyone who's joined us on the call, sharing these inspired Kentucky stories about how we can improve ourselves and support our neighbors and friends and families to be healthier across the state of Kentucky. I will send you all a survey this afternoon. I would love to hear your ideas about future topics, as I mentioned, give feedback on today's event. I always welcome your ideas for improvement, ideas for speakers, and future topics for this webinar series. Again, my name is Rochelle Seeger. I'm extremely honored to be working here at the Foundation for a Healthy Kentucky. Thanks to our speaker today, Valerie Horn. You saw her contact information, and I'll share the recording and slide deck with you that will probably be available on Monday, and I'll send you an email. Thanks, everyone, for joining us today. As I mentioned at the top at the introduction, this is about partnerships. It's about improving health in Kentucky, and it's about sharing our stories. An honor to have had you all on the call today. Please feel free to check out our website, healthy-ky.org, where you'll find upcoming events and recordings of Health for a Change training series. It is about partnerships. I look forward to seeing you on the next webinar. Thank you so much, everyone. Have a great afternoon.